Okay, so I'm with the Nipissing Specialized Geriatric Services, which includes the seniors mental health stream of the program, the newer Nipissing Specialized Geriatric Clinic, and the Behavioral Supports Ontario program. So just to give a quick little overview of each of the programs, the Seniors Mental Health Program is a community outreach consultation service, providing services to those with mental health, as well as cognitive assessments, diagnosis, and treatment recommendations. And that's for older adults with age-related mental health needs and, again, cognitive challenges in the North Bay and Nipissing District. The Specialized Geriatric Clinic is similar in the sense that it's also a community outreach consultation service, providing assessment, diagnosis, and treatment recommendations. But this time for those patients that have complex medical needs, geriatric syndromes like frailty, falls, and polypharmacy, and again in the North Bay Nipissing District. Sorry, it's a bit cut off with BSO at the bottom, but our Behavioral Supports Ontario program is a program that works again with older adults in the community who are at risk of or who are dealing with responsive behaviors or personal expressions associated with things like dementia or sometimes substance use and other complex mental health needs. So our overarching program with the three streams comprises of quite a team. We have geriatric psychiatrists, care of the elderly physicians. Right now we have an internal medicine specialist as well as nurse practitioners who are all providing consultations. We have RNs, RPNs, social workers, OTs, and other clinicians that are helping with the initial assessments. And through the BSO stream of things, we have links with team members that can provide education for staff, healthcare staff, as well as who can support families and caregivers. So the Seniors Mental Health Program, again, comprehensive mental health and cognitive assessments are completed. This is sort of what you can expect from the program. Then they'll be brought in usually to the clinic to see one of our consulting specialists who will work on diagnosis and treatment recommendations. The team can provide education and support to individuals and their families and connect them to other agencies as well. And we do provide some limited follow-up as required. We ask that referrals come from primary care, physicians, or nurse practitioners who are committed to following up on any recommendations that are made. We require some investigations usually recent within the last 3 months, including updated lab tests and recent head CT, as well as ECG. The wait time can be, we'll say up to 3 months, but it depends on sort of a triage priority that we go through. So those with more serious mental health concerns or suicide risk would be seen on a priority basis. And we're happy to say that we can be very flexible in the way that we see folks through home visits, through coming into our clinic, and wherever the person lives at home, whether it be long-term care, retirement home, we'll see them there, as well as phone appointments, usually for follow-up over the phone, but we can be flexible in offering some OTN appointments as well. With the newer Specialized Geriatric Clinic that opened several months ago, we're committed to providing comprehensive geriatric assessments, as well as consultation appointments for diagnosis and treatment recommendations. We are finding as we get up and running that sometimes we're initiating some of the treatment plans and then offering some follow-up as required for those treatment recommendations and changes that we might have made or other tests we might have ordered. And similarly to the seniors mental health stream of things, we're offering some support and education for individuals as well as their families and connecting them to other community services if it's needed. We appreciate referrals from primary care physicians and nurse practitioners. However, we're open to considering referrals that come from other agencies for those that may not have primary care, so such as home and community care, GCOP, other healthcare professionals. And we are hoping that there might be some available labs and diagnostics, kind of recent within the last 3 months. It's preferred, however, not necessarily required. Right now, we're sort of seeing that our wait time is, maybe up to a month, but we're seeing people quite quickly. Being a newer program, we anticipate down the road, we may end up with a bit more of a wait list, but for now, it's a fairly quick turnaround time. And again, open to seeing people at wherever they may be in the home, at our clinic, by phone, by OTN. And we are, with all the programs, open to bringing OTN to someone's home too, to connect with a specialist if that's needed. Through Behavioral Supports Ontario, we can expect a comprehensive behavioral assessment from one of our clinicians with tailored approaches and individualized strategies to help manage and reduce responsive behaviors or personal expressions. We work with patients, families, any caregivers, community supports to be able to try some unique approaches and reevaluate things. We have team members that can provide education for the families and care partners, as well as healthcare providers. And we also offer, we do a lot of work with transition supports across the continuum of care. So that might be people that are at home waiting to go to long-term care and need transition support with that. They might be coming into hospital or being discharged from hospital, for example. So we're working with long-term care BSO teams to be able to share information that's unique for that individual to help with their care plan. Referrals to BSO can come from essentially anywhere. It doesn't have to be primary care. It can be patients and families can self-refer. It can be any healthcare agency, and it can come from primary care as well. There are no specific referral requirements, and the wait time is fairly quick. We have a goal to at least contact patients or caregivers within 72 hours. And of course, we're sort of triaging things as well and prioritizing things based on the need. And again, very flexible in how we see patients: home, long-term care, retirement home, clinic, OTN, phone, any of those means. We have recently developed a combined referral form for all 3 streams of the program. It can be found on the North Bay Regional Health Centre's website. And just at the very top of the website in the search bar, if you just look for geriatric referral, it will, one of the first things will populate medical clinic program forms, and it'll be right in there. So that's what the combined referral form looks like. Right at the top, it gives you the option to choose your preferred service that you're referring to. However, we do have an intake process, and we'll make sure that the appropriate services are assigned. For the Behavioral Supports Ontario stream of the program, if anyone is familiar with referring to BSO, we would still ask that the usual referral pathway is completed, which is on the NEBSO website. It's an electronic referral that way, or by calling or faxing the BSO central intake. Our combined referral form, we're hoping that it's mainly used by primary care to help just sort of streamline that process amongst the services. And then hopefully I'm okay for time, but I just had a couple of quick case examples. Okay for time? Yeah. With the specialized geriatric clinic, we had one of the first patients that we saw in our clinic was somebody that was referred to us for unexplained abdominal pain with an elevated cervical cancer marker. Just getting to know this patient and her family, it was very evident that she was fiercely independent, and that was the thing that mattered the very most to her. What ended up happening, however, was this patient who was living independently at home in North Bay ended up being so unwell that she actually had to go live with her daughter outside of the province. And so by the time we had gotten the referral and were booking the consultation, we ended up having to facilitate an OTN with Dr. McKenna to be able to make that work, since the patient was out of North Bay at the time. But we were able to get a couple things organized. It turned out that abdominal pain was secondary to constipation. And the elevated cancer marker was related to some rheumatoid arthritis. The patient was able to return to living at home, and we were able to bring in some community supports and have our occupational therapist do a home visit for some assessments as well with living independently. And we had some amazing feedback just with the ability to be able to get connected with a geriatric specialist in such a quick turnaround time. We were able to prevent some emerge visits and hospitalizations and have this person return to living at home independently. And this patient experience just highlights the work through BSO, where we received a referral for an 80-year-old man who was expected to have some transitions. Firstly, it was to a short stay respite. It was actually quite a long respite where he was stayed in the long-term care for a couple of months to give his family some respite time. He was a fellow who was very social, enjoyed country and fiddle music and watching French soap operas, and it was very important to him that he have food and snacks available. So once he was in long-term care, knowing he had access to all those things that were so important to him, he actually adjusted very well. We were able to connect with the long-term care BSO teams to share my personhood summary and transition care plan, sort of tips and strategies that work well for this person. And we involved our transition support activation worker, who's somebody that's able to provide visits before the person moves, as well as follow up afterwards and make sure they're settling in well and help with any little glitches along the way. This fella ended up being discharged from his short stay respite back home to apply for crisis long-term care placement, and we supported that second transition to long-term care as well. And through the seniors mental health stream of our program, the types of referrals you may expect us to receive would be something like this one, where we had gotten a referral for an 81-year-old man referred for cognitive and functional changes, as well as some mood symptoms. This gentleman was somebody who previously worked as a mechanic and enjoyed tinkering in the shed, so enjoyed to keep busy. So we were able to provide a home visit to do his assessment along with his cognitive testing and some mood screening. A comprehensive assessment was completed, and he was booked in to see our geriatric psychiatrist, where he was provided with an Alzheimer's neurocognitive diagnosis with associated anxiety and mood-related changes. We were able to make some recommendations for a cognitive enhancer and antidepressant. We were able to connect this patient and the family with home and community care for some home care supports and some future planning discussions around long-term care application. And I think we had some feedback quotes on the last couple of cases that got cut off at the bottom, but that's okay. And just to finish off, we have ways that you can contact us either through phone or fax if there's any questions or wanting to make referrals.